Hi, I'm Dr. Steven Goldstein, and this is another in our series of reducing the confusion in gynecology. The topic I want to talk about is birth control pills. There's so many myths associated with it. But specifically, I want to talk about the choice of pills, and especially as it might apply to adolescents or women under 30. I believe it's either in Oregon or Washington State, they're going to allow pharmacists to prescribe birth control pills. And although those women will get contraception, they won't get the non-contraceptive benefits of picking the right pill. If somebody's main concern is their skin or no weight gain, or they've had headaches in the past or breast tenderness, by choosing the right pill, you can often not only get contraception, and not only give a reduction in bleeding, and actually there's a reduction in cancers, but that's a whole other topic. But you can also give some of these non-contraceptive fine-tuning benefits by understanding the difference between different pills. Basically, all birth control pills have the same estrogen. It's called ethinyl estradiol. And when they discover a new beneficial progesterone, they'll pair that with ethinyl estradiol. So most of pill-related side effects, sometimes it's related to the dose of estrogen, but most often it's related to the progesterone it's paired with. And some progesterones are notoriously good for some things as opposed to others. For instance, one called norgestimate, which is in the orthocycline family and now many of the generics, so good for skin that one of its members of that family was actually FDA approved for treating acne. But the comment I wanted to make is many women will bring their teenage and adolescent daughters in here and say they'd like to put them on the pill, which is something I did for my daughter as well. And often they'll say, well, I want the lowest dose. And I'll say, okay, why? And they'll think that that's the safest. The reality is the lowest dose pills are too low for women under 30. Why? Because bone is a hormonally sensitive organ, and bone is growing geometrically until about age 30 or 35, at which point it slowly falls until menopause, when there's no more estrogen, it falls dramatically, which is why osteoporosis is so important in postmenopausal women. And because the pill works by suppressing ovarian function, so that hormone is not on top of what you make, it is now instead of what you make. In the lowest dose pills, you get less bone growth in women under 30 than you would if they had their own menses, their own periods. And understand the regular dose pills are not high dose. When I was a student, pills came in 80 and 50 microgram strength. When I was a resident, they were 50 and 35. Most of my career, they've been 35, 30, 25, and 20. Now they make it 10. And the 10 is great for perimenopausal women controlling bleeding, but 10 and even 20 are too low for women under 30. And it is really amazing how many gynecologists aren't even aware of this. I hope this is helpful for you or anybody in your family. Once again, this has been Dr. Goldstein.